There are some people who view health insurance as a necessity, and many others who view it as a luxury. Some believe it's something to look into when you're past a certain age. Senior insurance advisor Marcia Gill says these common perceptions are simply not true.
Mom, dad, children, everybody needs to have health insurance.
Marcia Gill has been an insurance advisor for over a decade. She says it is very common to meet people who feel that health insurance is out of reach for them.
The attitude is that it's too expensive. That's the first thing people will say. But then when you look at the cost of health care, do you really think that health insurance is expensive? So that's the first thing, that's the first resistance to it, and it even prevents persons from inquiring into what it's all about because they figure they can't afford it. NHI will cover certain conditions and up to certain limits, and it will also limit you to just Belize. So if it is required that the person needs a treatment that's not available in Belize, NHI would not cover that. So that is where the need for health insurance comes in.
If you're looking for a plan for you and your family, here are 3 of Gill's expert tips. Number 1, work within your budget.
Persons have the option to really control how much they pay for health insurance. Because if you go with a high deductible, that can help reduce the cost of what you pay for insurance. So there are ways that your insurance agent can assist you in order to offer you a plan that suits your budget. If you're looking at costs, there are many ways that you can tweak your policy and ask for what you really want. For example, when we spoke about NHI, so a person who is covered by NHI, they have basic benefits that they can access if anything happens. So that might not be of concern to them when they're purchasing a health plan. So they can look at the bigger things. So they could give up those small things because they can cover that under the NHI and focus on the most serious conditions. If they were to occur, then the plan would step in at that point and pick up where the NHI program would not.
Number 2, know what's in your plan.
You need to know what your plan has, because when you use it, you need to know what you're expected to contribute towards your health care. Your deductible is your out-of-pocket. So that is the amount that you will pay before the insurance starts to reimburse you. After you have satisfied your deductible, then you go into the sharing, the co-pay, where the insurance, and it depends again on the type of plan that you have, whereby the insurance will pay an amount and you will pay an amount. For example, in a situation of 80-20, after you have satisfied your deductible, the insurance will pay 80% of your expenses. You'll be required to pay 20%. That's your co-pay. You need to know what you're covered for, because sometimes clients don't take the time out to review their policy, and it's not until something happens and then you need to use it, that is when they realize what they have and what they don't have.
Thirdly, get a policy sooner rather than later, especially when youth and health are on your side.
Health is what buys the policy, right? So you have to access it when you're still healthy. We don't want to wait until we start to develop illnesses that will make us not insurable. So definitely, usually younger means healthier. Not all the time, but in most cases it does. So that is the time that you want to buy your policy. And as well, the younger you are, the more affordable the premiums are. I can say that having health insurance, definitely you get to catch things earlier. Because any little symptom, you will consult a doctor because you have the health insurance, right? Whilst if you didn't have a health insurance, then you might delay or you try to self-medicate and, try to fix the problem. And then the problem festers and festers until it goes into something bigger. So definitely having your health insurance does allow people to access health care at an earlier stage that can make the difference between life and death.
Gill estimates that an individual comprehensive plan can cost you less than $200 monthly, but she urges people to take advantage of group plans like those that are offered at your workplace, as it will cost a lot less.
You can't lose, and it gives you that peace of mind that you're able to access healthcare wherever you are.